We are happy to make this conference now an ongoing fixture, and that's not, as I said, just because we like to have a captive audience around health and safety. It's actually because there's not enough support that's given to health and safety reps kind of operating in Western Australia. We need more safety reps, and we need more support for safety reps beyond just the mandatory kind of 5-day and 1-day training that you get. While that training can be great, can also be average, but I hope you're going to good training providers. There's a lot more going on in the world of health and safety that needs to be done to assist safety reps in terms of undertaking your role, because it is getting more complex. Our workplaces are getting more complex, and as we're adding kind of more occupational diseases into the space that we need to be aware of, as we're kind of learning more about psychosocial health and safety, the roles of safety reps are more important than ever, but also more complex than ever. And, it's been 20 odd months since the Work Health and Safety Act came into effect, after many, many years of campaigning and implementation. And as you all know, West Australia has gone from having the weakest health and safety laws in the country to probably being the strongest, if not amongst the strongest in the country. That was well overdue. We had a pretty grim decade or two of health and safety in Western Australia with an act drafted in the early 80s that really didn't support health and safety well in our workplaces, and certainly didn't support health and safety reps either. Didn't just happen overnight. We've had hundreds of improvements in our regulatory system come through with that act. The focus on psychosocial safety, the introduction of tougher penalties and across the board higher fines and tougher penalty provisions, along with industrial manslaughter. We've prohibited insuring against work health and safety penalties by employers. There's an increased amount of union rights in the Act. There's an increased amount of safety rep rights in the Act. For example, safety reps now have the right to direct that unsafe work cease in workplaces, which is something that they didn't have before, and a whole range of new and great powers. Safety reps and unions have also now got this great little power that I'll talk about later, which allows us to refer issues to the regulator that gives them a 48-hour window to review and make a decision on safety issues in workplaces, which is something that's been used a couple of times by unions and safety reps the past couple of years, which I'll come to. Really can't undersell the importance and the package of changes in here. We were seeing in Western Australia, and I know a lot of you have heard me say this countless times, but we're seeing kind of prosecutions for workplace fatalities where negligence was involved in workplaces that were leading to penalties in the $20,000 or $30,000 mark for those fatalities. It was just so well short of, expectations from the trade union movement, but expectations of the whole community. What we've seen now is that we've gone from having those $30,000 fines for deaths to the point where we've now seen a $900,000 fine for a workplace injury come into effect the past couple of years. We've actually seen a jail sentence awarded to a construction director whose negligence led to a fall on a construction workplace on an agricultural property. So we've gone a long way in terms of improving that act, and we've actually started to see kind of some real penalties come into play for work health and safety breaches. Our work is nowhere near done yet, though, and certainly kind of at UnionsWA we recognise that. And the act is only really a really small part of what actually makes workplaces safe. There's still a whole range of other things that we see that need to be improved. I'll talk a bit about the regulator at the end. We've seen substantial improvement in how the regulator is regulating, and we've seen substantial announcements from the state government around funding for the regulator across the last 5 years that have been well overdue. Still can see some ways that we can still improve funding and activities coming out of WorkSafe. We've got too few safety reps in our workplaces. After a steady decline over decades, we've been motoring around the bottom of the amount of safety reps that we see in workplaces. We don't actually see the stats anymore because the stats aren't collected and retained, but we believe there's probably only around 2,000, kind of to 2,000 to 3,000 safety reps in WA, which falls very far short of the number that we think should be in workplaces. We're pushing more of a reliance on safety professionals in workplaces, which, in my view, they play a very important role, but they don't play the same role that a good, trained health and safety representative does in terms of being an independent representative in a workplace, advocating, from the bottom up of a workplace in terms of the changes and cultural and other things that need to be done to make them safe. Tragically, we've still got ongoing problems with occupational disease in Western Australia. We're now about 35 or 36 cases of silicosis in Western Australia, which I'll come back to in a little bit. Workplace violence is at epidemic levels in a range of our workplaces. We're seeing it everywhere. Workplaces are struggling to get on top of it, particularly seeing it, in areas in the public sector such as education and health, absolutely huge levels. In anywhere that's doing service delivery, like the community sector, drug and alcohol service providers. I've heard some real harrowing tales the last few years about what's happening in those workplaces. We've seen just the last few weeks, the SDA, the Union for kind of Shop Assistants, coming out talking a lot about violence, and even on the weekend in the paper there was a disturbing article, but a great article, and how it brought light to, I think, what's happening in bottle shops in this state and the abuse that those workers are facing just every day for turning up to their jobs. We know that psychosocial change kind of is vitally important. And this is my real huge soapbox issue, and I know you've heard me say this before, but workplaces are dealing with psychosocial wrong in workplaces. There is this, move to wellness and to individualise psychosocial in our workplaces. WA has actually led the country in our psychosocial guidance. We're the first jurisdiction in the country to publish any psychosocial health and safety guidance. We did it for the FIFO sector. Now we've done it for general industry, and the rest of the country has been catching up to the very good work that's been occurring by the WHS Commission in Western Australia. But how we're seeing it implemented in workplaces is a huge problem. And to use an example, in recent months, have been dealing with a retail employer who has gone ahead and taken out pretty much as many humans as they can in their store and replaced it all with self-serve checkouts. The very few people that they still employ are 16, 17-year-olds. There has been a huge uplift, I think, especially around the Christmas time last year, of workplace violence in that workplace. That workplace has identified that the lack of humans in the store is causing violence and harassment issue for the few that remain. Customers are getting frustrated and very wrongly taking it out on these poor 16 or 17-year-olds. The company's solution to this problem was to implement a campaign to ask workers to ask each other if they're okay throughout the day. That was their response to the violence in the workplace. There was a company decision that led to it. They identified the harm that was occurring, and the solution was people to ask each other if they're okay. Not to look at staffing levels, not to monitor security, not to look at the things in work health and safety that you look at in order to review and check and reflect and fix the actual hazard. They're putting a Band-Aid on the problem at the end rather than actually looking at why this violence and harassment is occurring and looking at the solutions for it. There is very big problems in this space, and I'm glad today that we're actually able to provide a fair bit of reflection on psychosocial health and safety. I kind of think in planning this with Julia, I was like, people are a bit done with psychosocial health and safety. They're a bit sick of hearing about it. But then actually I've seen it just grow and grow and grow, the interest in it. And I think part of that is that a lot of it's being pushed back onto safety reps, and safety reps are having to respond in workplaces, I think, to the inadequate responses in some places around how it's being regulated for. So I think our keynote today is going to talk about it a bit. One of our SIRES sessions is going to talk about it a bit as well. Julia Armit and Anthony Pearson from the State School Teachers Union are going to share a fair bit in that space, and they're probably the two people in the WA union movement who know the most about this. So it should be a good session for you. Just the second part, and where we're going to concentrate on a little bit this afternoon, is occupational disease. And I think this is a great area where I think when we talk about our legislation being very important and one part of solving the problem around health and safety in workplaces, is actually not always the solution. WA has actually had the best health monitoring regulations in the country. Despite our previous act being quite old and antiquated, that provision in the act was probably the most advanced. It required regular screening of workers. It required employers to be quite proactive in how they did health monitoring for occupational disease. But essentially it was just never done in a lot of workplaces, and you only have to look at the kind of fact that we've got about 35, 36 silicosis cases in Western Australia as an example of how that fell down, because silica and how to cut stone safely, this isn't some new thing that we're just discovering. Like, we've known the problems with silica forever. The Romans knew the problem with silica. It was an occupational disease that was kind of well known throughout the 1800s, and those control measures were extremely well known. But alarmingly, when we moved from cutting product that was kind of 40 or 50% silica in kind of natural stone to moving to cut product that was 95% silica, somehow in that transition we forgot everything that we once knew about how to add actually do this safely. It which just boggles the mind. And WA actually, again, I've been a strident kind of critic of things that kind of happen in Western Australia from time to time, but actually WA is a jurisdiction that led the way on this. Implemented kind of the most proactive kind of regulations around requiring low-dose CT scans instead of X-rays to try to detect silicosis in the workforce. But actually, once WA did that, and there's a very good little program run by the regulator where they went and found about 90 or 100 workers who had been given X-rays to test for silica to see what kind of harm might have occurred to them, and had been completely cleared of any harm by those X-rays. They actually went back and gave them CT scans, and it was actually quite disturbing what came back. So this is 90 workers working in the artificial stone industry who thought that they were completely clear and could continue to work safely. I think they found about 8 cases of silicosis in those workers that had been cleared by the X-rays out of about 90. Again, they found another 30 or 40 who had kind of signs of lung damage kind of from working in the industry. It's a pretty small sample pool that they used, but to have so many workers who've been cleared then actually discovered to have occupational disease is actually deeply disturbing. It's also deeply disturbing that there's been no attempt to go back and find workers who've left the industry and had been cleared by X-rays at that time and try to track them back. It's also that industry is an industry that's been highly reliant on temporary labour from overseas. Has brought in huge amounts of temporary labour into Western Australia. They've worked in this industry with no safety protections and then have been sent back to the country of origin with no testing, no follow-up, and probably a lifelong burden of occupational disease being moved on to other countries that don't have healthcare systems quite as robust as Australia's. It actually should be a national scandal, I think, what has occurred in the industry. And you'll see just even on the weekend and on Friday on ABC Radio, you've got the artificial stone industry out saying union campaigning and the issue is over the top. And that if we try to regulate the artificial stone industry, that we'll see all home renovations stop, apparently, as if there's not actually any kind of alternate product that is freely and widely available, even in every single Bunnings and every single store that you can possibly find. But this is the kind of nonsense scare campaign that we've got. Can you imagine today if the asbestos industry was out saying, oh, no, we can't ban asbestos because the rate of new home construction might slow down? It's absolutely bonkers kind of campaigning, I think, from the artificial stone industry that's occurring. So I'm glad we get to focus on occupational disease, because if that's what's happening in artificial stone, what we know through working with kind of the Cancer Council and a range of other industries as well is that there's a lot of things such as diesel, well-known occupational carcinogens that just aren't getting much attention in Western Australia, and it's something that we certainly need to turn kind of some attention to. And I was just going to note as well that check how much time I've got. Yeah, I've still got a few minutes, so I can still get on my soapbox. There's actually been a substantial shift in public debate on work health and safety since we last had our last conference. And this has actually just been extremely welcome from the union movement. I think the campaign of unions and workers kind of pushing for stronger health and safety laws has actually led to a pretty strong renewed interest in health and safety in the community debate. It used to be that health and safety you'd only get in the media if there was a fatality, unfortunately. But, quite rightly, I think this attention, and actually with some proactive good work that's happened out of WorkSafe for the last few years, has been extremely positive. And I was just going to touch on, I think, what some of the major health and safety kind of things that have occurred kind of since we've had our last conference. Firstly, you can't go past the kind of prosecution of FMG for refusing to provide documents to the regulator. We know that Western Australia is a state which, the resources industry gets a pretty good run in the media, and government can be from time to time pretty risk adverse in terms of taking them on. And I reflect that maybe 10, 11 years ago, we had in this space that you'd only see prosecutions for work health and safety breaches where there was a fatality. It was pretty rare to see anything that was a regulatory breach or anything that was a near miss or an injury. We're actually starting to see kind of some movement where there's been some prosecutions around failing to supply documents, which is a really welcome sign. We've also seen WorkSafe, and it's the first time I've seen it since I followed health and safety in the state, we've seen WorkSafe prosecute for lack of notifying incidents to WorkSafe as well. That's something that we know occurs in workplaces across the state. We know that the kind of 10-day rule of workplaces having to notify WorkSafe of any injury which requires more than 10 days off work. We know that is just universally not followed and not reported to WorkSafe, particularly around psychosocial injury. So to start to see these prosecutions come through and the attention of the regulator on things that aren't just fatalities, I think it's been really positive in this state. It's hard to go past as well the move around kind of sexual harassment and sexual assault that's kind of occurred in workplaces. This is a work health and safety issue, and it is, there's a large part of the response to this issue needs to be done through work health and safety. You see WorkSafe gear up substantially on their response to this in the resources industry, not only prosecuting for refusing to supply documents, but also issuing improvement notices and having quite a proactive campaign. That's been really welcome to see out of the union peak body. It's an area that's been talked about for a long time, and it's great to see it enter the work health and safety frame and be addressed appropriately. What needs to be improved there is attention on our other industries. Quite rightly, the resources industry has received hell from the regulator and hell in workplaces, which has been great, but it's not the only industry where there's substantial gendered violence and sexual harassment occurring, and we're very well aware of that in the union movement, and it's a space where we need to see the political side of government probably inject some substantial amount of money in its response. The prison dog attack, as I talked about, $900,000 fine for a workplace injury, as on the screen, which is a very welcome change, and actually WorkSafe's we've seen a response around corrective services, which has been long, the problem child of state government in terms of health and safety has been corrective services for a long time, and it's very good to see the WorkSafe go after the state government, its own state government in some ways, very hard on health and safety, but still a lot more work to be done there. We've seen other fines around $600,000 for a worker being trapped under a staircase, which again is a good substantial shift in the kind of penalties that we're seeing in Western Australia. That's real money. It's not the $20,000 or $30,000 for a workplace fatality. This is real money now coming into penalties for work health and safety breaches. And as I talked about before, unions have got this new power in order to kind of refer workplaces to the regulator. We know that safety reps and unions see a lot more than what the regulator can ever possibly see. We're in workplaces every single day. You're in your workplaces every single day. We've long had a problem where, when I first started in the union movement, I said Tony Hall and a bunch of others in the background, we would call WorkSafe from the union to say, workplace X, there's a serious problem with Y, like you need to get out there and need a response, and we were told that they wouldn't talk to us because we're not actually in the workplace, we're not actually part of the workplace. WorkSafe just literally refused to deal with trade unions, and we couldn't get past the contact line. Now we've got this provision in the legislation where they can't not talk to us. We can refer disputes directly to them. And that's actually seen quite good results for both safety reps, unions and workers, where the regulator's been forced into a workplace to kind of resolve issues. And as we saw at Murdoch University, the veterinary school, actually, once the regulator was pulled in, I think they issued 20 or more improvement notices in that workplace, which actually substantially changed the safety culture, the resourcing, and the support that was given to the workers in that workplace. So there's some real positive changes that we can see, and really can't overstate how significant it is. One of the other real positives that we've just landed, and I don't think there's been any public publicity on this, is that we're now seeing WorkSafe collect and report on workplace deaths that are occurring in vehicles as part of employment. Traditionally, the vast majority of workplace fatalities that occurred in a vehicle as part of work was just reported in traffic fatality figures, not even broken up as a workplace fatality. It was never actually included in our workplace fatality deaths, which has kind of, for me, been a long bugbear of the trade union movement and the Transport Workers Union in terms of finishing. Particularly when now that we're in a space where, not that I use the services, but there's a lot of workers dressed in all black riding bikes around the CBD in the middle of the night delivering food. We've got a large amount of grey fleet where workers have to operate their own private personal vehicles in a private capacity to deliver everything from aged care services through to pretty much anything in a home environment. That whole shift to the NDIS and moving care into homes has created a huge issue in terms of the use of vehicles and personal vehicles for work. Let alone issues with tradies, apprentices and fatigue, like massive issues in the vehicle sense. I suspect we're actually going to see our workplace fatality numbers in Western Australia double. And I know it's silly to say, but that's actually a good thing, because we're actually collecting the statistics about where those fatalities are, instead of just pretending that half of all workplace fatalities don't exist, and we don't report on them, and we don't kind of collate them and review them. Really important kind of outcome that's occurred in Western Australia, and I hope we'll see a substantial shift in how we're dealing with work health and safety in that space over the next few years. So I've kind of my summary of the last year, and I think some of the major themes that we're going to talk about today. Plenty of challenges, but also I think plenty of positives that we can talk about as well. And I know I've got a reputation of being cynical and dour at these kind of events, and I can honestly come today and say, we are in a positive space in work health and safety in this space. We've got a regulator who's doing some good work, although some room for improvement. We've got some legislative wins that are now becoming embedded, which is really welcome. But also want to look forward to kind of campaigning more on occupational disease, we're campaigning more on psychosocial and actually getting that right, as well as finding more ways to support safety reps in the work that you do, and the very important work that you do. I think when health and safety reps first came into Western Australia, I think we had about 50 deaths per million workers in the state. Today we're looking at about 10 deaths per million workers in the state, so there's been a substantial drop. A lot of people argue there's technology and other things that have played into it. I personally kind of think that safety reps, have been a major part in how we've actually driven down and created far safer workplaces in Western Australia. We know for every one of those workplace fatalities, there's probably hundreds, if not thousands, of significant workplace injuries that leave people kind of scarred for life in terms of workplace harm. And I think that's why we do what we do. And very happy at UnionsWA to have a room full of safety reps today.